Today, we're going to talk about something important that could potentially change your job search strategy, and that's how to decipher these job descriptions in medical coding. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, and content creator, and on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. And today we are talking about job descriptions, how to decipher all of the different things that they're looking for in job descriptions. And we're actually going to look at some active ones because I feel like that's the best way to really go over some of the terms that you may see frequently is by looking at some live, legitimate samples of what these job descriptions for different medical coding jobs look like. So if you're new and you're just starting out, medical coding is that process of taking all of the different patient procedures, services, diagnoses, translating them into code sets that we use not just for billing, but for a lot of statistical purposes as well. So the goal of a medical coder is to read through a lot of medical documentation to abstract all those pieces of text and translate them into the different code sets that we utilize, part of it for reimbursement, part of it for statistical purposes. And there's a few major code sets we use: ICD-10-CM, which is the International Classification of Diseases, revision 10. There is ICD-10-PCS, which is the procedural coding system. Then there's CPT, which is current procedural terminology. And we have the HCPCS level 2 codes. That's a lot of things like drugs and durable medical equipment, and then some insurance specific codes as well. The job descriptions out there for medical coders that you'll see when you're applying for a position will include things like what certifications they're looking for, years of experience, skill sets, and qualifications. And those are the things that they're looking for because they want the candidate that they're going to hire to be successful in that role. And these are the things that they've identified will make someone successful in that role. Now, in some cases, they will tell you, here are the things that we would prefer you have, and here are the things that you absolutely have to have. Like they may say you have to have your CPC certification, but then there might be others that say you have to have your CPC or Certified Professional Coder certification within a year of hire. So there's a lot of variety of things going on, which is why I think it's just good to look at some of the different examples. Some of them will include things like salary ranges. Some of them may include things like the work environment. Is it a fast-paced? Is it a detail-oriented? Is it more relaxed? Is it remote? Do you have to be on site? Is it hybrid? There are a ton of remote or work from home positions out there for medical coders, but you want to make sure that you're getting the right education if that is your career path. So if you want to be a certified medical biller and coder in as little as 6 months without going into student loan debt, you definitely want to take my Masterclass. I share all of the secrets that I have learned in the past decade plus, all of the industry insights, the right way to train for medical billing and coding, how to save you time and money, how to get a discounted training program, how to get a free laptop with your program, and much more. This masterclass gives you the roadmap on how you can become a job-ready medical coder in as little as 6 months. It seriously just takes away like all of the guesswork. But you have to click the link that is in the description below, so go and register for it. Remember how I mentioned that there's different code sets that are utilized? So there's also different types of coders, and the type of coding that you do, such as if you do inpatient, professional fee, risk adjustment, you might be working with different varieties of those code sets. So if you went through an educational track where all you were prepared for was professional fee coding, you would use CPT, you would use ICD-10-CM, and you would use HCPCS. In inpatient coding, they use ICD-10-PCS, which is a whole different system. With PCS, you have a root operation, and then you kind of almost turn the dial for the numbers, almost like you would for a lock. Depending on your approach and different factors, those numbers on the dial change to come up with the complete ICD-10 PCS code. So if you're not trained on PCS, that's an important thing you need to know for jobs that are titled things like inpatient or sometimes clinical coder. So you might think that, oh yeah, this is a coding position and I can apply for it, but if you don't have PCS training or the certification to prove that you know PCS training, they might not consider you a good candidate for that position and will send you maybe a rejection letter. So there are people out there who feel like they're getting a lot of declines for certain positions, but it might be because they're applying for the wrong positions. So one of the great tips that I have is if you're on a site like Indeed.com and you're looking for a job, instead of just typing in medical coder or medical coding, what you can do is actually just type in here ICD-10-CM. So if you're familiar with ICD-10-CM, that's one of the code sets you were trained on, and you hit that enter button, it will bring up all of the different positions that are out there that are looking for that skill set of ICD-10-CM. And you can see right here, the first one isn't a coding position, it's a billing specialist, but they want someone who has that skill set, that they're familiar with ICD-10-CM coding. So you will get a wider variety of jobs that you could potentially apply for beyond things that just have a title that is, quote, medical coder. So this first job that it brings up here, it even gives the salary range, which is nice. It tells you that it is full-time, so 40 hours, and it says it's remote. So remote meaning you can work from home. I'm sure there's lots of setup qualifications that you need in order for it to be a HIPAA compliant setup, but it says they also are hiring for 2 people. So when we look at the qualifications, here's a key word to look at, is this word preferred. Preferred means we would like you to have this, but if you're the right cultural candidate and we have other things that we want to hire you because of your skill sets, you don't have to have that. We're just preferring that you have that. So it says here ICD-10 1 year preferred. They prefer you have a year of medical billing. But if you're a fast learner, you maybe were a really good student, they would consider you if you didn't have 1 year of experience. So here's our job description. It's the position title. They report to the supervisor of revenue cycle management in the billing department, and it's non-exempt. Non-exempt means it is not a salaried position, so you are paid on an hourly basis. Now here are the responsibilities, including auditing charts. Now for this, I think they're using the term audit in the way that I probably don't use the term audit, more of a quality assurance or checking to make sure that things are correct, not so much the formalized audit process that a full-time auditor would think of, where you are looking at charts, comparing them to bills, reporting out your findings, the corrective action, meeting with the providers to give that feedback, and that there are potentially, some ramifications that happen or future plans for that provider. So it says also billing sheets, obtain authorizations, and perform other work associated with billing and administrative processes, read and interpret insurance explanation of benefits, contact payers regarding any discrepancies in payments if necessary. So contacting the insurance companies if there's payment discrepancies, also reviewing all of those explanation of benefits, this is what we paid and this is why we paid it. Enter information necessary for insurance claims, such as patient, insurance ID, diagnosis, so all the demographic information, typing in the codes. It doesn't say that you are necessarily coding them, but you're working with those code sets. So this is a position that could be considered for your apprenticeship removal if you have a CPC or a COC, because you are working with codes. Ensure claim information is complete and accurate. Follow up with the insurance company on unpaid or rejected claims. Resolve issues and resubmit claims. Post-insurance and patient payments using medical billing software. So all those insurance payments where they send you, tens of thousands of dollars, and it was for this patient on this day for this procedure and this patient on this day for this procedure, making sure that that's all attributed to the correct accounts. Respond to inquiries from insurance companies, patients, and providers. Check ICD diagnoses and CPT treatment codes from online services, and use traditional coding references. So I'm assuming that would mean like your code books, your ICD-10-CM, your CPT book, or maybe even some encoders or edit programs. Resolve customer and patient inquiries regarding billing discrepancies, ensuring high levels of customer and patient satisfaction. So this sounds like one where you are answering billing questions on the phone. Not all billing positions you do that, but there are some where you are working with patients. Now, in larger organizations, they have people who are very trained in customer service and customer satisfaction, handling those type of interactions. So just because you're working in billing, that doesn't necessarily mean that you are going to be working with patients and on the phone answering phone calls from patients. But in some of these cases, like this position, it sounds like you might be doing that. Utilize intermediate Excel skills. Excel skills are becoming higher in demand in all of the revenue cycle type positions. Following HIPAA guidelines, they did spell HIPAA correctly. That's always a good indication. assist the billing team lead in related projects. And then here's where we get into the required knowledge education. So these are the things that are different from preferred. Prefer is we would like you to have this. You'd be a better candidate in our eyes if you have this. Required is you have to have these. Now, there might be organizations that they may sway a little bit. And certainly if you feel like this is a job you're interested in and you're willing to put in the time to apply for it and you think you can prove yourself, yeah, go ahead and apply for it. I mean, what's the worst that can happen? They'll just say no. But understand that there are going to be some of those positions where there might be an automated process that the person who's recruiting for this knows to look for, a certain credential. And if you don't have that credential, they're just going to put your application to the side. It might not be anything about you. It might just be part of that automated process. I've worked in organizations before where even though I was the supervisor hiring for those positions, I was not able to get any resumes, even if it was someone who was referred to me, until they had been screened by human resources. There were even situations where there were very, very good, highly recommended candidates that I couldn't even look at their resume because they didn't pass like a personality test screening with human resources, and it couldn't get any further to even get on my desk for me to look at their resume. Now, of course, my experiences don't account for the entirety of the industry, but just understand that there are some organizations out there like that. So the things that they're like, these are the more hard things that we're looking for: high school diploma or GED, prior experience billing for medical services, a year of experience directly related to billing or healthcare, working with the healthcare management revenue cycle, place of service codes, modifiers, HCFA 1500 forms. Oh my gosh, it still says HCFA 1500 forms. We haven't called it a HCFA 1500 form in almost a decade. Isn't that funny how sometimes, like they took, the other thing interesting about this one is if you'll notice on some of it, it said ICD and they didn't specify ICD 9 or ICD 10. They just said ICD, which is interesting because it's almost like they went, oh yeah, well, it's not ICD 9 anymore, it's ICD 10. And they just took out the number and didn't even specify ICD-10 CM versus ICD-10 PCS. And ICD-10 and CPT associations, proficiency with Microsoft Office applications and intermediate to advanced Excel skills, knowledge of patient billing terminology, collections, as well as government regulations. That's good. Working knowledge of CPT and ICD-10 CM codes and electric claim filing. So here are the things now where they're saying highly preferred. So you're going to be a much better candidate in our eyes if you have these particular abilities. So if you have a CPC, if you are able to organize and prioritize work and manage multiple priorities with minimum supervision, you are highly organized with a strong attention to detail and accuracy. You have excellent verbal and written communication skills, ability to speak clearly and concisely, conveying complex or technical information in a manner that others can understand, as well as ability to understand and interpret complex information to others. So because this is a position where you'd be working with patients and insurance companies, you have to be able to have that communication, be able to take some of those terms that we utilize in the revenue cycle that we know what they mean, but maybe a patient doesn't understand what they mean. And then it just kind of gets into the pay, the benefits, schedule, supplemental pay, education, experience, etc. So let's take a look at some others we have here. So here we have inpatient coding integrity specialist. Sometimes when you see specialist on them, those can be in some organizations the higher tier position, but not always. So this one, it says, here's our salary. They have ongoing need to fill these roles, so it sounds like they have a lot of them open. Qualifications, you need to have a high school diploma or equivalent, so a GED. We have the benefits. I'm not going to read through the full job description, but let's see. This is actually a coding integrity specialist 3. It's work from home. You're going to work, see, here's where we get into it. ICD-10 CM and PCS. So remember I said oftentimes when you see that inpatient, they're talking about facility fee coding and they want you to know PCS. So if you're just looking at this as a new coder and going, oh, it says it's a coding specialist, I'm going to apply for this, not realizing that it's the difference between a professional fee coder and an inpatient coder and a risk adjustment coder. So if you put in an application for this job and you have your CPC and you were never trained on ICD-10 PCS, they would likely reject your application because they're looking for someone who knows ICD-10 PCS code set. So someone who would qualify for this job would have to know ICD-10 PCS, which is nowhere near the same as the ICD-10 CM, and you have to do DRG validations as well. So it says here in this role, you're going to assign, validate, and or edit codes for the DRG and abstracted data, and you have to work in patient records for multiple facilities using ICD-10 CM and ICD-10 PCS. It's an accuracy based, it's productivity based, and you have to utilize the complete patient medical record documentation in assignment of the DRG, doing the validation or editing of the codes or DRGs. So it says here, qualifications, high school graduate or GED or equivalent, undergraduate, so an associate's or bachelor's degree for HIM or HIT is preferred. So what did we say about preferred? They will accept you without that. You're going to be a better looking candidate if you have it. If not, they may still consider you for this position. Minimum of 1 year of acute care hospital inpatient coding required, with 3 years preferred. So again, if you don't have the full year, you're maybe at 8 months, or you think that there's just a lot of things that you can contribute to this job, by all means apply to it, but understand this is what they're really looking for an ideal candidate. It also says the RHIA, RHIT, or CCS is preferred. Those are AHIMA credentials, Registered Health Information Administrator, Registered Health Information Technician, or CCS Certified Coding Specialist. For the CCS, you do need to know ICD-10 PCS for that exam. And then down here, you can see again for the experience, it's saying acute care hospital inpatient coding 1 year required. So not preferred, required. So chances are good if you don't have a year that you wouldn't be considered as a candidate for this position, but you never know, maybe if you are close or you have some other good applicable experience and they don't have anyone else applying for this position, you never know. Now, this one is for risk adjustment coding. In risk adjustment coding, you actually only need to work with ICD-10 CM. So you can see here, they talk just about working with ICD-10 CM, working with the insurances, and under the job responsibilities, it does just as ICD-10 CM, nothing about CPT, nothing about HCPCS, nothing about PCS. So you do have to have a level of accuracy, probably some productivity. Yep, productivity required as well. It says requirements. So again, these are the things that chances are good if you don't meet these, they will reject your application. 3 years of recent production coding experience in risk adjustment coding, your high school diploma, technical savvy with high level of competence in basic computers, Microsoft Outlook, Word, and there it is again. Microsoft Excel, they're really looking for that these days. Strong written and verbal communication skills, ability to work independently in a remote environment, 5-year coding credential through AHIMA or AAPC. No CCA, that's the Certified Coding Associate through AHIMA. So that's kind of like their almost equivalent of the CPCA, their apprentice status. But say maybe you're someone who's worked in ICD-10 CM a lot, but you only have 2 or 3 years experience, you could still consider applying for this because maybe they won't find that candidate that has 5 years experience, and maybe you have, really boku Excel skills, and they'll go, oh, you know what, we'll kind of give and take a little bit. This person looks like someone who will be a good cultural fit. Now, another place you can look for jobs is codersdirect.com. I highly, highly recommend them. So you can see here, so this one, this is actually a good one that we should look at because it says professional fee coder, but it says for inpatient critical care ICU coding. So this could be one where you're coding for services of patients that are formally admitted to the hospital, but you're billing for those professional fee services, the services that are performed by clinicians and providers. And yeah, that looks like exactly what this is. It's pro fee coding, so coding CPT, ICD-10, CM, HCPCS for patients that are inpatient, but we're doing the E&Ms for them. So you need to know not only the evaluation and management, the split share knowledge, so billing for providers and advanced practitioners, so physician assistants and certified registered nurse practitioners, maybe even certified nurse midwives. You have to know critical care, global guidelines for trauma, bedside procedures done in the ICU. They're looking for 3 years experience in professional fee, so pro fee coding, inpatient and critical care, and you have to have a certification through AAPC or a HEMA. And then here's their benefits. So not a ton of information here, but they do give some good information about what they're looking for. They don't have it broken down maybe between the preferred versus the required, but a good outline of what this position is. So just because you see inpatient doesn't always necessarily mean it's inpatient facility fee where you're working with PCS. So really look at some of these job descriptions to decipher what it is that they're looking for and if you're a good candidate for it. Now, another thing I want to mention, because not everyone knows this, but you can actually search for jobs on LinkedIn, not just because like you're connected with recruiters, which is the top-notch way to get it, but there is a way to search for jobs in LinkedIn. So if you're looking for, we can just do this here, do a medical coder job and type that in. So let's just go ahead in here and type in medical coder. I think this one, let's see if it does let you do remote. It does let you do remote positions. So if you're looking for remote medical coding positions, you can check on LinkedIn as well. They do have a job search function. So medical code remote, Optum, they're a good company to work for. And it says apply on their website. Let's take a look here and see what it says. So this will just link you over to their website, and they have medical code remote. The primary location is Texas, remote considered. So it sounds kind of like they might prefer you live in Texas, but if not, you can still apply. So if we just kind of skim this, it looks like it's a full-time job, 8 to 5, 40 hours a week. Primary responsibilities, what can we quickly pull out of here? I'm actually going to zoom this in just a little bit so we can see it a little bit better. So here we can see it's a lot of charges, a lot of work queues, and it says down here that they want you to work with a lot of EHR stuff, inpatient admissions, discharges, transfers, operative reports. They want you to know CPT. They want you to know ICD-10. It doesn't say CM or PCS. It looks more like a pro-fee coding position because of the CPT though in there, and that they want you to know the Medicare National Correct Coding Initiative, which is NCCI, payer guidelines. It talks about how you're going to have to work with the physicians, so submitting queries or clarifications when the documentation is unclear or ambiguous from a coding perspective, assist with physician queries. So let's get into here. Required qualifications. So required are more of those have-to-haves for this position. High school diploma, a year of coding experience, ICD-10 experience, professional coder certification with credentials from a HEMA, so AAPC, I don't know what this ROCC is. That's a new one to me. CPC, COC, CPCP, or CCS must be maintained annually. Ability to use a PC in a Windows environment. Microsoft Excel, oh my gosh, there it is. Create, edit, and sort spreadsheets. It's incredibly important these days to be able to work with spreadsheet data. Analytical formulas like VLOOKUP, IF, and EMR systems. They would prefer you have vascular surgery and cardiology coding experience. Again, preferred means if you have those, you'll likely be viewed as a better candidate. This is an excellent one to look at because they have their telecommuting requirements. So you have to have the ability to keep all company-sensitive documents secure. You are required to have a dedicated work area established that is separate from other living areas and provides information privacy. And you must live in a location that can receive a United Health Group approved high-speed internet connection or leverage an existing high-speed internet service. So a lot of these larger organizations like Optum do have requirements about this. So it says that you have to have a private area separate from other living areas, so you can't be, in a corner of your bedroom with a significant other walking around, getting dressed, etc. It has to be a private, separate area. So you can see there's lots of medical coding jobs out there, and the better you can interpret these job descriptions, you can understand what jobs are ones that you may have a higher probability of being hired for. And if you're just starting out in your journey and you want to know the best way to increase your odds of getting a job after you finish your training, definitely sign up for my masterclass in the description below. So making sure that you have the right training, the right certifications, that you have skills like Microsoft Excel, you can cast the widest net possible to find your dream job. I will see you guys in the next video. Until then, just keep on coding on.